Andy Cummins again here, Black Swan Bodywork, Austin, Chicago. Here with Joy, and this is part 2 of a 3-part series on lower back, head and neck pain. In the previous video, we worked together to help clear and loosen up the lower body, the hips primarily, through extending the legs and working on hamstrings. And now we're going to move up into the lower back so we can start to see what's going on with the muscles here and how it's articulating around the spine. I'm just going in a little bit. This is a lovely way of starting some initial contact with the lower back, particularly if someone is holding already because of physical pain. In this procedure, rather than pushing into the person to try to relieve any tension, as you can see, Joy is supine, so face up, so I'm going to curl my fingers into the muscles of the lower back, and so it's her own body weight that's creating the pressure, so it's a lot easier. And again, it gives the person who's receiving the right to realize that they're in control of how much pressure or what kind of technique or the duration or anything. So, you know, we want to instill that sense of trust in our work through our touch. So these little moves here, and this is what's happening underneath, I'm just using my fingers as fulcrums to go into the soft tissue of the body. You can imagine as we're standing upright, all the compression that happens in lower back, right? Our own weight, the weight of gravity. So we're trying to open up this area here in the lower back, and I'm primarily focused right now with this finger pressure into the muscles of the lower back from the 12th rib just above the iliac crest. So we have the muscles of the erector spinae muscle group coming through the lower back, and we also have the quadratus lumborum, which is a big muscle in size but also in function. It connects the hip to the lower back. So a lot of times when the person is feeling some lower back pain, along with opening the hips like we did in the previous video, we come into the lower back and try to address the quadratus lumborum, which goes from the lower ribs, primarily 11th and 12th rib, and attaches to iliac crest. So right now I'm just using this hooking motion. I have Joy's body propped up with my foot, so it's in a locked position. So she feels that additional support and she can let go even a little bit more. And now I can go ahead and hook underneath and just use my fingers to start to create some space from the spine out laterally. Okay. In the previous video, when we were working on the lower body, we were using the legs as levers to help open up and stretch the bigger muscles of the lower body, primarily hamstrings and quadriceps. But here now we're moving into lower back, so the muscles are shorter and thicker because they're more of a weight supporting muscle group. And this twisting motion helps not only loosen but create a little length in the lower body. And in these moves, it's my weight shifting first forward to get nice contact, and then on my exhale back to create the length and space that you're seeing. I'm just going to come over and do the other side. First of all, just to see how our movement is. And again, for the body workers viewing, take note of body position, how my weight is evenly distributed over 2 points of contact, my knee and my foot, so it allows me to shift my weight when necessary, which takes the strain off of my lower back. It also takes the strain off of trying to have clear breath, conscious breathing when you're working. So I'm going to lift up and support like before with my foot here, and then I'm just going to hook underneath. And when I say hook underneath, I'm just immediately lateral of the spinous processes of the lumbar vertebrae in the lower back. In this little trough, the lamina groove. And I'm using that as a natural contact to lean back and stretch and create some length. Very nice. And before I have Joy come up to a seated position, I'm just going to do a little work here through the abdominal area. In Chinese medicine, they refer to this area as hara, their energetic and physical center of the body. And again, referring back to traditional Chinese medicine, there's a lot of referral points or reflex areas that are associated with all the organs in the body. So this palpation is both diagnosis and treatment because it allows you to feel the different conditions of these reflexes, which reflect in the condition of the organs of the body. So I'm just doing a simple palpation. We think about when feeling for imbalances, anything that's either harder or softer than the normal healthy tension that should be held in the abdomen. So that gives us some indicator of how to work or where to work. So after just some nice loosening here, I'm going to proceed to bring Joy up into a seated position. So remember, our focus here is lower back, so anything we can do to coax not only support but forward movement now to stretch the muscles of the lower back, as hopefully you'll be able to see in this simple move of just bringing her up into a seated position. So you just relax now and take an inhale and exhale. I'm just moving her into seated position and placing her arms on the outside. Take all our lovely hair and put it over here. And just taking a view of how she sits in this position here and to see if I can take note of any restriction that's replicated here in her lower back muscles. You can see, if you observe, that along with the lower back being just a little restricted, you see maybe a little tightness in the hamstrings. I can move your arm this way. As you can see, with this space here of the back of the knee in relationship to the mat. So that tells me that we can try to coax a little bit more length into the hamstrings, which in essence will open the hips to help release the lower back. So I'm just gonna put your arm this way. And you just keep breathing like you are, because you're doing fantastic, Julie. Take a nice inhale for me, and then exhale. So just using my body weight, yes, to open up her lower back. Just easy, nothing forced. You really have to allow yourself to be present when you're working, yes? To feel for any significant change. Now, with the body in tension like this, it gives me a sense of where the muscle or muscle groups, in her case, are affected. And it brings to light a little of the imbalance that's going on. So these are all really good things to note when you're working, along with our sense of touch, where there's a lot of overt signs that we can train ourselves to look for and physically see imbalances. Okay. So I'm going to ask Joy to turn over now into a prone position, but because of her situation with her lower back, I'm going to ask that she puts her front of her pelvis over this pillow. As you can see, it goes right across her pelvis, right across. It spans both of the ISs, the anterior superior iliac spines, or the front of the pelvis. And that helps take out this curve a little bit so that she can receive some of the work right on the lower back. Okay, so we're happy about that. Let me just take this and put your arm like that. You okay? And I'm just going to start a little bit just by doing some general loosening here. And again, in doing the work, either beginner or seasoned body worker, it's always good to know where you're at before you proceed forward. So the time spent palpating for the bony landmarks to really see where you're at before you start applying some heartfelt compression, which I'm doing right now. And just shifting my weight back and forth, following my breath, inhaling back and exhaling forward, just to create some nice looseness in the longer muscles of the back, the erector spinae muscle group. So out like this. One thing I continually tell myself and my students when I'm teaching classes, be it either here or in Chicago, about that sense of keeping your body in line with your work, and try not to work out of rotation. You want what you're dealing with right in front of you, right? So you can be fully aware of what you're doing. Working out of rotation, as you can see, it makes everything a little bit more cumbersome, both shifting your weight to apply the technique, or on a deeper level, just taking an honest breath, really. I mean, if you take the rotation out, the breath more readily comes in and out. And that's what we're trying to do here, too, as along with loosening the muscles on joy. We're trying to get that sense of stability back so that you can feel comfortable about taking a deeper breath. Sometimes, you don't want to breathe into the area if it's painful, or you feel that it's closed off. So now here we're creating some space and inviting that breath to come back down. And just a little movement here. So I'm going to feel for her hip, and I'm going to curl my fingers underneath the front of the hip so I have a nice hand hold, and I'm not curling my fingers digging into the musculature. And again, using her body weight as a neutral, I'm just going to lean back and then with my other hand apply pressure down. This is a nice movement back and forth to create some nice openness in the back. Softening a little bit. I can see a little active point here. There's no doubt when you're on a tight area, especially with someone who's aware of their body like Joy. I mean, there's an immediate connection. So that last reaction told me how these muscles here, not only in the lower back, but a little higher above the 12th rib, are firing a little bit. So I'm going to go in there with a little broader contact to try to get some looseness in this lower area. So in doing that, I'm going to come down a little bit so I can utilize my own body weight. And I'm going to start applying some pressure with the flat of my elbow, just lateral of the spine. So you can see how my arm runs parallel with the spine, and my hand is in a neutral position. So that maximizes the point of contact here against the spine. And I'm just going to lean in a little bit. And as I lean in, my palm turns up, and that rotates the point of contact, so it not only loosens the muscle, but rolls it away from the spine, creating a little space, and that's what we're looking to do. And I'm working with our breath as much as possible, being conscious of our inhale, and on the exhale, leaning in. And I'm replicating that awareness in my own breath when I'm working. Just a nice sense of rhythm that we both are sharing right now. I'm just going to repeat that again. As the muscles of the lower back continue to connect onto the sacrum, which the erectors do, the tissue that's there to anchor those muscles, called aponeurosis, are thicker, because they functionally need to be thicker to hold on or anchor the erectors. So when applying pressure, I find that a lingering pressure there allows the tissue, particularly the fascia that surrounds the tissue, to change its viscosity, its condition, so it softens a little bit so that the muscle can start to go back into a healthier, more supportive shape. So continuing this process, I'm going to, again, feel, palpate for the area here and get tuned into the bony landmarks and the muscles involved. And here we have the 12th rib, or the floating rib as they call it, the 11th and 12th rib. And then below that, this group of muscles that are palpable from the side here, primarily moving from the spine out. We have the erector spinae, particularly longissimus, the most pronounced of the lower back muscle. And coming out a little farther from multifidus, and then finally quadratus lumborum, which connects from the hip up to the 12th and 11th rib on a more of a 45-degree angle. So because of the position of quadratus and the other two muscles that I just mentioned, I'm going to change the acclimation of my own body to Joy's so that I can utilize a constant pressure into the lower back with a supported thumb here. I'm using this because it fits right into the area. And I'm just letting my body weight sink in and make contact with the muscles of the lower back. It's so nice to work with breath when you can. That consciousness of working with breath, quite lovely. Because if they're used to breathing, and I recommend this to people when we're working, if particularly lower back, that they can feel the space, they can feel the relaxation a little bit with every breath, so they're more willing to continue with their deep breathing. Okay, that's nice. I'm just going to repeat a little bit on the other side, and I'm going to take a little different stance because this side needs a little bit more down pressure, down and away, more of a sustained pressure this way. And I noticed this when I had her sit up that when she was bending forward, I could see how the muscles grip differently on one side. So this side functionally different. In the last video, when I was working with Joy in the supine position, the different techniques and the way she was reacting to the techniques led me to look at the hip and the importance of loosening the hip to help free up the lower back. So again, the same thing is replicating here in prone position, feeling certain patterns that I feel can be better served by loosening the hip before we go into lower back. So one advantage of using the leg here is that we can bring a sense of loosening through the hip using the leg, and the contact point can be larger, so the patella or the curve of my knee can fit right into the soft tissue over gluteals. It's delicate work. You have to really be easy. So here, studying the anatomy, both the physical and energetic, it gives you a sense of the layout here. And where I'm compressing into is the soft tissue of the gluteals, in between the bony landmarks of the lateral border of the sacrum and the greater trochanter of the femur. So it's like a crescent moon shape here, which contains all the muscles of the hip. So I'm doing general application with the flat of my fist into the gluteal area. Loosen. And position slightly different so that we can be in a position to allow ourselves to lean in. Now, in this position, I feel this is a good connection for what's going on. So my body is open and her leg is supported in such a way that I can move her leg by simply moving my upper body. And that really affects the point of contact here. It's always interesting when I'm teaching classes and trying to share the techniques that I've learned over my experience as a body worker to students. And like I mentioned, if it's either the CEU classes that I'm teaching here in Austin or Chicago, I try to be very clear not only with the application of the technique, and by that I mean how we use our breath and how we apply our body weight, but also the bony landmarks, just so we have no doubt where we're making contact with the person. And here, the greater trochanter and the lateral border of the sacrum are the key to being lining us up so that we can apply pressure and create some space and loosening in the gluteals and the rotators. So this prolonged pressure again has the effect of really loosening up the area, which it is noticeably looser right now. So that's always good to end on a high note, wouldn't you agree? So we're going to come out of that and just end this segment of lower back and hip with just a nice little traction move here. And then we can proceed into the third part of our video series, addressing now the upper back and shoulders and neck. And thank you once again. My name is Randy Cummins with Black Swan Bodywork. I appreciate you watching. Thank you.